But it has been noted that there is one primary side effect of psychotropics that is common to all.
Most medication and psychotropic medication, I've noticed, tends to flatten things, so that while you're decreasing the depression, you're also decreasing the joy. And so you're minimizing what it means to be human in the service of avoiding dealing with a problem.
They can't connect to the world around them. They feel like there's no feeling, which is, you should have some feeling there.
All that's doing is really numbing them down, and they're not doing the work that they need to do to resolve that issue that's going on somewhere internally.
But the numbing of emotions is not the only way psychotropic drugs affect the user. Each of the 5 main classes of psychotropics has side effects of its own. Typical antipsychotics, such as thorazine, are powerful chemicals originally designed to shut down the central nervous systems of mental hospital inmates. They are now mainly used on people with serious mental problems, and they can cause feelings of helplessness, deterioration of the mind, neurological damage, dementia, trembling, twitching, and damage to internal organs, to name a few. Anti-anxiety drugs such as Valium and Xanax are prescribed for nervousness, anxiety, and panic disorders. They can cause patients dissociation, cognitive impairment, increased aggression, fatigue, hallucination, and acute amnesia.
They've got foggy thinking, they're bloated, they have weight gain, they're now diabetic. It's one symptom after another, all caused from the drugs that they're taking, and they don't realize it.
Stimulant drugs like Ritalin, Adderall, and Concerta are mainly used for people with so-called attention problems, such as attention deficit hyperactivity disorder. These drugs are very addictive and can result in stunted growth, weight loss, manic behavior, heart palpitations, neurological tics, cardiac arrhythmia, gross brain shrinkage and malfunction, anxiety, insomnia, violent behavior, and even sudden death. Ritalin, a stimulant commonly prescribed to children, acts on the body in a very similar way to cocaine, but is far more potent. And recent studies show that it can cause permanent changes in children's developing brains.
So you're going to have an issue that some of these medications, particularly the stimulants that they're giving like Ritalin and Concerta, all the ADHD medications actually shrink brain tissue.
They know that these psychiatric drugs destroy cells, destroy brain cells, shrink brain tissue. How can that possibly ever benefit anyone? It can't. That's the simplicity. It's not possible.
Antidepressants are a 4th class of psychotropic drug. As their name suggests, they are used to treat depression and mood disorders. The list of side effects includes blurred vision, dry mouth, low blood pressure, internal bleeding, weight gain, sleep disturbance, seizures, impaired cardiac function, and psychosis.
The most common thing that I see is the sexual dysfunction. So women having a hard time reaching orgasm or just finding that their libido is lower. And I see that with men as well. And the second most common thing I see is weight gain. I have to say it is not terribly uncommon to see a 40-pound weight gain with antidepressants.
One study found that Paxil, a leading antidepressant, increases the risk of breast cancer in women by 7 times. Perhaps riskiest of all is the drugging of pregnant or postnatal women with antidepressants for depression.
When the mother takes the drugs, the psychiatric drugs, or any type of drug in that, like an antidepressant or anti-anxiety or an antipsychotic, that's going to affect the baby as well as the mother, not just the mom, because the baby's going to get it straight through the umbilical cord, through the bloodstream.
The drugging of pregnant women has led to a 20 to 30% hazard of preterm birth, brain damage, and lower fetal age at delivery, and nearly triples the risk of severe birth defects.
And the antidepressants have been shown to cause something called PPHN, which is a heart problem in newborns. And I think it's criminal to be giving medications to women knowing that their babies are going to be at risk.
When mom takes Paxil, she can have a baby born with the
Sometimes they have the limbs are missing. It's called limb reduction. Can have cleft lip. They can have serious heart defects, missing chambers, or the arteries in the wrong place, and also can be born with the organs growing outside of the body.
And these are just a few of the many, many side effects of psychotropic drugs. Among the top 3 best-selling antidepressant drugs, called SSRIs, there are 1,817 possible side effects associated with Prozac, 2,194 with Zoloft, and 2,497 with Paxil. Interestingly, among these is the worsening of the exact same symptoms the drugs claim to address.
They cause depression. They cause suicidal tendencies and ideologies. So they cause a lot of the very exact symptoms that they're supposed to be correcting.
They're being treated for depression with a product that's going to create depression. They're treating for a psychosis with something that's actually going to create or has the potential of creating a psychosis.
Atypical antipsychotics, one of the newest classes of psychotropic drugs, are used mainly on adults and children diagnosed with bipolar disorder. They are also known as mood stabilizers. Though launched with storied claims as miracle drugs with little or no side effects, atypical antipsychotics have recently been exposed as creating severe weight gain, diabetes, coronary heart disease, acutely irregular muscle movement, pancreatitis, and delirium. Though the new antipsychotics were originally approved only to treat schizophrenic adults, over a 7-year period, prescriptions for children jumped 5-fold to an estimated 2.5 million prescriptions. And this drugging is coming with serious consequences.
You know, I've seen kids who have had significant weight gain on some of the antipsychotics, where they were pre-diabetic. You know, they've had, changes in some of their cardiovascular functioning. So there are potentials to really damage the child's health.
When you get drugs that you're giving to kids that we know cause extreme weight gain and attack the liver, attack the kidney, that have long-term results, these children that we're giving them today, this medication, we may be doing, kidney dialysis for in 10, 15 years.
And it is not only children that can be affected. It has been estimated that psychotropic drugs are to blame for over 16,000 traffic accidents every year in the United States. A study only looked at drivers 65 and older. And what happens when these unwanted side effects surface? Usually, the psychiatrist will prescribe yet another drug.
It's called polypharmacy. It's just, adding additional, if the first drug doesn't work, you add a second drug. If you have an adverse side effect from a drug, then you add another drug to deal with the adverse side effect.
And then let's say they start an antidepressant and now they can't sleep. So in order to counteract that, they'll be given a sleeping pill. Then a tolerance builds up. So they might now need another drug because they're now at a tolerance level of the first drug that it's no longer creating the, quote, expected or helpful result.